All right. So again, thank you for the invitation to participate in this important activity meeting. Of course, Caries is a global epidemics, right? We have so many children, so many people suffering from this disease. So we have to look for different ways to manage the disease. One of them, which is not a new alternative, it's Silver Diamine Fluoride is been in the market for more than 50 years. This is something that I want to talk to you, which is a different way of presentation of Silver Diamine Fluoride. Let me start with my presentation, and again, thank you for the invitation. As Ankita said in the presentation, I am the past president, the immediate past president of the IAPD. I finished my term only in June of this year. Now the new president is Dr. Figen Seyman. We are the global voice for children's oral health, and many of you have attended many of our meetings. And we are, that's our aim, right, to improve children's oral health by different means. So I hope that you can join us in being a member and also to attend our meetings. So Silver Diamine Fluoride, right, we're gonna talk about these four items. First, description of the product, then the effectiveness and the properties, and then we're going to talk about this novel diamine silver fluoride, and finally the final messages. So what is silver diamine fluoride? It's an oxidizing agent, it's antibacterial, and it stops the process of tooth decay in enamel and dentin. And there's some evidence that tells you that also prevents new caries lesions. If, for instance, it's applied into pit and fissures of molars. So it's this is the components of silver diamine fluoride. 25% is silver, which is antimicrobial. 8% is ammonia, which is the solvent, and 5% is fluoride that serves for remineralization, right? So this is sort of the components of SDF. SDF, as I told you at the beginning, is not new. It's a product that it's been in our profession since the late 60s, right? This is the person who first used silver diamine fluoride. It's Mizuho Nishino from Japan, and the first article was published in 1969, right? And you can see here the reference. It was published in June of 1969 in the Journal of the Osaka University Dental Society, right? Remember that our next meeting, the IAPD meeting in 4 years, is going to be in Osaka, Japan. So we're going to go back to where the beginnings of silver diamine fluoride. And here you see some pictures of children. This is a journal from Japan. And you can see the pictures of the before and after the application of silver diamine fluoride, and these are pictures from like many years ago. So the first product that was commercialized was Sapphoride. Sapphoride is silver diamine fluoride at a concentration of 38%. Nowadays there are several and different types of silver diamine fluoride, like and from different parts of the world, Argentina and Brazil and Australia and the US and India. They have products that have been produced there. So just to show you this timeline of events, right, during the development of silver diamine fluoride. In 1969 was the first scientific publication by Nishino. In 1970 was the first commercial product, which is Sapphoride. In the 80s, the worldwide diffusion Brazil, China, Argentina, etc., and some other countries. In 2015, the product was accepted in the US. The FDA accepted the product, and by now it's generalized use in the world. And there are many, many publications, which this is something that wasn't. Yeah, you can see some publications before 2000 or 2010. But most of the publications and randomized clinical trials were done in the last 10 years. So this is one of the first articles that opened the eyes of in many places in the world where there was no information about silver diamine fluoride. This was published in 2009 by Rosenblatt, Stanford, and Niederman. And it's interesting, the title, it's Silver Diamine Fluoride, a Caries silver fluoride bullet. So in this article, they of course review the product, and then they review also articles that were published until then, right? And as I told you, there was no randomized clinical trials. There was many reports, but there was a lack of science on using the product. Actually, in many parts of the world, the product wasn't used because of that, because they felt that there was no enough science to use the product. So again, this is the silver diamine fluoride, the Japanese product, and I can show you some pictures of different products around the world. Caries Top is 12% and 30%, a product from Brazil. There is also this product from Argentina called Fluoroplat. Also, Fagamine is from Argentina. Fagamine, which is silver diamine fluoride 38%, which is a concentration that really works, or at least it has been proved in different scientific articles. The 30% or 12% hasn't been proved in research projects. This is Rivestar, which is the Australian product. Now it's, for instance, in Peru, this is the only one that is accepted, Rivestar from Australia. Then we have the product that I met during our meeting in Bhopal last November, and this is SDF 38%. From Kids eDental, and the American product Advantage Arrest, which is the product is in the market maybe less than 10 years, probably like 8 or 7 years, right? And this is silver diamine fluoride at 38% as well. So the effectiveness and properties of let's go back to the article, the original article, and since this article, there has been many other articles like trying to find properties of this product. And of course, the main one is Caries Arrest, which is, I'm going to show you some information about this. Then Caries Prevention as well, and anti-dentin hypersensitivity. So let's go for the evidence. First, silver fluoride as a treatment for dental caries. And there is this article by Horst, and Horst, of course, this is like a review. So they found that there was a high caries arrest. You can see here the percentage of arrest applying the product once or twice a year. And you can see here that in some populations, like actually the average is like 60% of caries arrest. This is the latest clinical practice guideline on silver diamine fluoride, and you can see here that again around 68% of cavitated lesions on primary teeth are expected to stop 2 years after SDF applications, with applications once or twice a year. So yeah, it's very high, right? It's 2 out of 3 teeth can get caries arrest by using silver diamine fluoride. This is the latest article by Margarita Fontana. This is very interesting because she started this randomized clinical trial in 2018, but then it had to stop due to the pandemics. So they had 1,000 children from 2 to 5 years old, and they apply SDF every 6 months, right? So they want to see caries arrest, and they want to see pain and pulp infection, quality of life for the child and family, and satisfaction and acceptability. Well, they again restarted the project after everything was controlled due to the pandemics, and they actually continued with the project, and then they had to stop. And why? Because the level of arrest was so high that having more children wouldn't make a difference. So it's interesting because Margarita always says that this is the only project in dentistry, at least in caries research, that had to be stopped before the end of the project due to the high effectivity of this product, right? So they presented the results only in May during the AAPD meeting. I was in that meeting and I was in that lecture, and they found 50% of reduction of 50% of arrest of dental caries by using the product, right? And you can see here how the project was made. Okay, so now it's caries arrest. Of course, it's 50%, 68%. It's different numbers, but there is a high level of caries arrest. The second property is a prevention of new lesions, and this is an interesting article made by a Spanish group in Cuba, and the name of the article, the title of the article is "Efficacy of Silver Diamine Fluoride for Caries Reduction in Primary Teeth and First Permanent Molars of School Children, 36-month trial." So what they found, there was a prevention of new lesions in primary and permanent molars using the product. And it is interesting because you can tell that there are some situations where you may find a good alternative to use silver diamine fluoride. For instance, if you have a child with a high risk of caries, and then you have molars that are erupting, first permanent molars, then you can try placing silver diamine fluoride on those surfaces, right? So yeah, it's staining a little bit the pit and fissures, and you can tell by this green arrow, but yeah, but there are no cavities, so it's a good option, right? And you can see here, for instance, this 3D scan showing silver sealing of the fissures, and you can see here also that there is minimal to no staining, right, by using this. So it's interesting because, yeah, there's the molar is erupting, you place silver fluoride, it can stain the surface, but then the question is, okay, what happens if later I place a sealant? So is there any impact on the adhesion of that sealant previously treated with silver diamine fluoride? And this is an article from 2018, and the title is SDF preventive treatment plus resin sealant. And what they found is that there's no problem. You can place a sealant after the tooth was treated with silver fluoride, and adhesion will be the same, or even in some articles they found that it was even higher. Niederman also did this article, and same thing, right? To find ways to prevent dental caries with silver fluoride treated before. So okay, so number two, it's a a product can prevent cavities. And the third property is controlling hypersensitivity. And this is an article by Suge in 2008. And what they did in the left is place ETA to remove, to open the dentinal tubules. And then on the right, they place SDF, and you can see how the tubules are occluded now with silver. So if that's the case, then we can use it as a dentin hypersensitivity product. So let's see here the justification of this is another article or project that we did some time ago, and placing silver diamine fluoride on these surfaces. This is an article that we published in Journal of Dental Research, and is the short-term effects of diamine silver fluoride on tooth sensitivity and randomized control trial. And well, this is, I'm gonna go very fast on this article. We use the visual analog scale to check for the sensitivity. And then we made the patient to write here to place where was the pain. And then we organize the patients into high sensitivity patients and low sensitivity patients. So I'm gonna go fast on this. This is the procedures and techniques. And it was done here in Peru. One group was in Lima, one group was in Cusco. And we had one group was given were applied silver diamine fluoride, and the other group was applied distilled water. So we place the patient on the dental chair, isolation of the tooth, drying with the gauze, and there's the application of the product with actually here you see a brush, but it's better to do it with a micro brush, right? And you can see here the clinical effectiveness, and the hypersensitivity was reduced by more than 50%, right? And you can see after 1 week. So yeah, it was a good product. And the good thing is that it doesn't stain the teeth, right? You can see here, yeah, of course, if there is a cavitation, then caries lesion, it will stain and it will go like very, very dark. But if there is an abstraction, which is not a cavitation by decay, then there is no change in the color. So that can be a good option to use in patients with hypersensitivity adults, right? So dentinal hypersensitivity is reduced 7 days after placing silver diamine fluoride on cervical surfaces with a fraction or tooth decay compared to placebo. All right, so we have these three properties of the product, which are very important, and actually they are now testing like the effect on gingivitis and other options, right? And we have the clinical practice guidelines, right, that I showed you before, and we have to check also often if there is any updates on these clinical practice guidelines. So let's talk about now the novel fluoride, silver fluoride product, and I'm going to show you a study that we did. We've just finished in June, so it's I'm going to show you some preliminary data of the study. It was done in the south of Peru. You can see here, this is Peru, this is Bolivia, and between Peru and Bolivia there is a lake called Lake Titicaca, right? This is the highest lake in the world. It's almost 4,000 meters above sea level, this lake, and it's very huge. So in this place, in the Peru part, there is a city called Puno, right? And in Puno, this is Puno, right? This is a city next to the lake. There is a population, and there is a population of kids with high levels of disease. So we did this project. We call it Quiru Poderoso, which is this is a kind of a mix of local language and Spanish, which is like a powerful tool. That's the name of the study, and it was done between us, our university in Lima, which is Cayetano Heredia, the University of Washington, and the University of Puno, right? To three societies. This is me and Dr. Peter Milgram, who is a very important researcher at the University of Washington with the kids. That's the first time we went there to check for the population. And it's interesting because before we started the project, we examined around 600 children from 3 to 5 year old. And what we found is that it was only maybe one or two that were caries free. The rest of them had different levels of decay, like one or two caries lesions, or like all the teeth were compromised. So this is the product that we tested. The first one in blue is Caries Arrest Silver Diamine Fluoride, 38%, but it's a gel. And the other one is 2.5% of sodium fluoride varnish. So all the teeth with enamel or dentin lesions were treated with 1 or 2 drops of 38% of the gel applied from a trained dental personnel from a single-use ampule with a micro brush, agitated to ensure coverage, and then excess dabbed away with a cotton. All the teeth after that were covered with 2.5% fluoride, sodium fluoride varnish, right, which is Fluorimax. You can see it on the red container. Applied also with a microbrush, and actually it was placed to mask the taste of the silver diamine fluoride and provide an additional prevention benefit, which it's questionable, right? I will say that mainly it was due to the taste, like to mask the taste of silver diamine fluoride. So this is some pictures of the actual study. Here we did it in the schools. We went to 6 initial schools. We brought these chairs, and actually they were very nice because they gave us a space in each one of these schools to put all our stuff. So here we have some pictures of the patients treated, and this was our design. The first examination was done in June 2022, like a year ago, and it was an application of SDF and fluor varnish. Then we did a follow-up examination in December, and the application of SDF and fluor varnish. And then afterwards, in June 2023, so that was only 2 months ago, the follow-up examination, and then that was the end of the study. So it was 1 year follow-up. Let's go and see the initial examination. The number of active surfaces at baseline, the mean was 26.3, right? There was actually the number of kids were 2,037, 3 to 4 year old children in 5 Puno preschools. The median was 22, and the range was between 2 and 80 surfaces with decay. And here you can see the number of active lesions at baseline, number of children and number of active lesions, right? So you can see that it's very high. And the examinations were with the NIDCR ECC collaborating centers criteria. The teeth were dry brush and dry with cotton gauze before exam, 3 trained examiners. And then it was interesting because every time that we went to Puno, we did like 1 or 2 days of training again of the examiners. All eligible teeth with enamel or dentin lesions were treated. Teeth were dry brush with 1 or 2 drops of 38 SDF gel, and then afterwards the treated teeth were covered with 2.5% of fluor varnish, as I told you before. So here we have applying the Caries Arrest Silver Diamine Fluoride gel, and then afterwards applying Fluorimax, which is a sodium fluoride varnish, 2.5%. See the colors, right? The gel is kind of blue, and then the Fluorimax, the Fluor varnish, is kind of yellow. So then we did a follow-up examination, December 2022, and here we have, after 6 months, the percentage of inactive lesions was more than 50%. It was 52%, 52.8%. So it was pretty much what Margarita Fontana found in her study. It was really high. But then there was a second application, right? After 6 months or 5 months, there was a second application. And you can see here the number of proportion of inactive lesions in months after the first 6 months. And then let's check the follow-up examination, which now the numbers, now the statistician is working on the numbers. We end up with having all the data collected, and then afterwards all the information was sent to the statistician that is now working on the numbers. But I have some numbers to show you, and this is probably the most important one. The median arrested surfaces were 69.2%, which is even higher than what we found at the beginning, but it's actually very close to what we found in these reviews, right? Remember that in the reviews, the clinical practice guideline and then the other review, the numbers were 68%, so it is pretty close to 70%. So it's really high. So and the other thing is that one of the things that was also a study was the level of satisfaction or of the parents, especially, right? And we found that it was really high, right? So so it was amazing, because I don't have the numbers now, but the acceptance of the product was really high among the parents. So that's very interesting. Actually higher than any other study done with this product. So here, some clinicians applied fluor varnish after application of SDF. We did it, but there is no evidence of what is the extra like a Caries Arrest activity, like applying fluor varnish. In our case, we found that we felt that it was a good thing to do to mask the taste of silver fluoride, right? And here are the kids after we finish the study. They were given some treats, like this is from Colgate, right? These toothbrushes and toothpaste, and also we gave them some T-shirts, right, with the logo and the of the study. So they were very happy, the kids, with the treats, right? And this is a kit, and this is the great difficulty by using silver fluoride, right? So he wasn't very happy, right, with the application of silver fluoride. You can see, and you can see that he's like cleaning his face, but actually he's spreading the silver fluoride around his face. Right? So he's not very happy about what they just did. And actually, and this is the same kid, and you can see the face, right? Because he was cleaning his mouth, all the product went all the around his face, right? So, but he was okay. All right. So, advantages of SDF gel, right? Of this new product is probably better control, because of course the liquid you can go all around the teeth or around the mouth of the patient, and then it can even sting you. So with the gel, you may have more control, right, over like where you're placing the product, and actually that will gonna prevent staining, right, of the surfaces around you. The addition of fluor varnish may improve the flavor, right? And we haven't tried this. We haven't tried a group with fluor varnish and a group without fluor varnish, so it may improve the flavor, and also may improve the efficacy. And again, this is not something that was tested, right? So yeah, because it's more fluoride may improve the efficacy. One interesting thing is that this is like a kind of a series of cases. There was no control on this study. It was just placing on the kids the product. So but the impact was so high that we were happy with the results, right? So now my final messages is that fluoride SDF has 3 basic applications: arresting decay, prevention of caries lesions, and anti-dentin hypersensitivity. The SDF in gel has demonstrated to be as effective as the standard SDF presentation, and more research is needed to explore this new SDF presentation. So thank you very much for your attention.